Well, the human body and brain are not meant to go through what these people have been through. So we are not meant to adapt and live under chronic fight or flight and chronic stress. The things that they've seen and survived, and the training itself, which leaves them entrained in fight or flight mode, entrained in sleeping 4 or 5 hours a night, entrained in withstanding and keeping their wits about them in situations the average person wouldn't even be able to function. They have had to wall off portions of their humanity, and they live in chronic stress and chronic inflammation, and some of them also have physical issues and disabilities from injury. So it puts them in a situation where it's almost impossible to be well.
Health, fitness, mindset, nutrition. Live better and longer. I'm Saad and let's hone in. So let's get back to the VA.
Let's do it.
How big is this problem?
It's systemic.
I mean, that's
big.
a pretty big statement. It's systemic.
It's systemic. So, we're talking about a government organization in a government that is in ultimate turmoil. Has been for years, but worse than it's been in a long time. And so funding for the VA, health rights and protections for our veterans, when they're an active asset, combat gear has never been better. Acute medical and trauma care has never been better. When they're no longer an active asset, the money's not there. And so I hate to use the word expendable, but sometimes that's how I feel in terms of medical care that's offered, that these people have become expendable somehow. And so the real problem would be keeping someone alive in service, and that is dealt with fairly well. But more people are alive longer and survive traumatic combat situations more. So there's more disability, more illness, more chronic disease. And people live longer now. We take overall better care of people's health. So more people living longer with more trauma, with more disability, and less available funding put towards that long-term care.
The way that you describe it, an active asset, expendability, I mean, those make it feel like we very much are cogs in the wheel of this military machine. And once they leave, they're no longer taken care of nor cared for. Is that like a true statement? Am I overstepping when I say that?
I think that is not an overstep. No, I think it's a sad reality that you see when you work at the VA and when you see veterans out in the private sector, as I do many times a day now in my care of veterans with testosterone issues. And they all say the same thing. I would go to the VA, but they won't help. I would go to the VA, but it's not service connected. I had to save money in order to do this. I don't have private insurance, but I have to go through a private process to get the care I need because I don't have another avenue.
Why do you think veterans suffer disproportionately from a lot of these problems, like mental health issues, like hormone imbalances?
Well, the human body and brain are not meant to go through what these people have been through. So we are not meant to adapt and live under chronic fight or flight and chronic stress. The things that they've seen and survived, and the training itself, which leaves them entrained in fight or flight mode, entrained in sleeping 4 or 5 hours a night, entrained in withstanding and keeping their wits about them in situations the average person wouldn't even be able to function. They have had to wall off portions of their humanity, and they live in chronic stress and chronic inflammation, and some of them also have physical issues and disabilities from injury. So it puts them in a situation where it's almost impossible to be well.
I mean, you imagine you going from a very normal air-conditioned life where you're sleeping whenever you want, eating whenever you want, not had a tremendous amount of structure, to all of a sudden going into the military, being incredibly structured, pushing yourself harder than you've ever been pushed, and then being thrown in a war-torn zone where now you are constantly thinking about, am I going to survive? Do I need to actually pull the trigger, right? Those are scary things.
Absolutely, and we've gotten pretty soft in the Western world. Even people that don't have every luxury still have basic needs met, and so we don't live in a way that this wouldn't be anything but going into the deep end, into shock mode. So the dichotomy matters.
So tell me a little bit about what happens when someone goes into active service. What are almost like walk me through, I walk into training the first day, what are the things that my body starts to go through, and why does that actually compound over time?
So I think the immediate thing is people have to go through basic training, and the whole idea with field training and basic training is stripping away things that don't serve as a tool or a weapon and instilling things that do. So it's an automatically stressful hierarchical situation with drill sergeants yelling at you. You're in stress. You've been an autonomous human living in a relatively cared for situation in most cases, to all of a sudden all those things are stripped away. So you're automatically in fight or flight. You're automatically with cortisol levels going up. You're automatically in a mode of fear and combat, even if you're not yet in field training. Then going into field training, as a statistic points out, that field training itself drops T by almost 50%. And that fight or flight scenario, the real world scenarios that soldiers go through, begin to create this fight or flight mode that stays entrained within the body. So that kind of stops a lot of the body's natural production of rest and digest physiology. So our gut likes rest and digest. That's how we digest our proteins and foods. Our endocrine loves rest and digest. That's how we make and signal hormones throughout the body. So they're already, even from the beginning, becoming more and more susceptible to chronic disease and problems, particularly mental health. Because the body, the brain, and the mind-body complex aren't meant to withstand these things, especially in the long term. So it'd be one thing if a soldier had a discrete training, a small deployment, maybe not any trauma, and then could go back to regular living under a year. But most soldiers become career soldiers, or at least have a tour or term they have to serve that's more than that.
And so is it, let's say I went on a 4 or 6 year tour. Mm-hmm. Is it a true statement that once I get put into that fight or flight mode, as you use the word, it entrains me and I'm stuck there to a certain degree?
If you have to maintain it, yes. And then there's a threshold that each person has that's individually developed that it's hard for them to become unentrained. So, you eat the same thing every day for 10 years, you're going to think that's what you want to eat, and your body becomes used to it. Your body becomes stuck in those modes. And so body and mind get stuck in soldier mode. And when they come home, they're dropped out into the world, expected to adjust without much help. And, I know there's great research right now out of Walter Reed to look at ways to identify early who needs help and what methods would help the most. But generally speaking, it's like being institutionalized your whole life and then stepping out and having to learn how to function again, with people that are worried about social media, and they're worried about how their hair looks, and they're worried about how people might perceive them, and they feel very alienated.
And so you're saying there's both a biological or physiological response, that their body is stuck in a fight or flight mode, on top of the fact that mentally they haven't been in the same headspace for 6 years, 10 years, like you were saying certain times.
Yeah.
So it's almost like re-entering society to a certain degree.
Absolutely.
Help me understand, once you start going into fight or flight and you're stuck there for 6 years, what does that mean for you? What does that do to your body?
Well, first thing that starts to happen is the adrenals can't keep up with the cortisol release. And cortisol is catabolic, so it helps you break down all sources of fuel in a fight or flight situation so that you have plenty of glucose to go to the muscles and plenty of food and fuel to fuel the action. The body can't sustain that for very long, and so cortisol curves begin to flatten, and you start to notice a change in hyperacuity and arousal in patients because they're kind of becoming more jumpy. Their startle reflex is up. Their eyes are a little bit wider, and they're starting to get stuck in that mode when the cortisol curve starts flattening. And then cortisol has a lot of relationships with all other hormones, as all things that work from the brain and body do in the endocrine system. And so the downstream effects becomes endocrine disruption across the board in a lot of cases based on this inflammation and this stuckness, so to speak, in fight or flight. And it takes a lot of behavioral therapy techniques to unpeel that onion, as well as physiological techniques, things like learning how to reactivate the vagus to calm things down, because the fight or flight mechanism is a bit opposite from what the vagus nerve would do. And so vagal building and vagal tone increase would help. And these people, unfortunately, don't get any of that help along the way. Like, wouldn't it be great if in the military there were some training exercises to create vagal tone improvements and being able to pull yourself out of fight or flight when you're not actively in combat. But those things are usually reserved for private functioning institutions that veterans would seek out once they're home, versus training through the process as they go.
Well, let's be realistic. Like, we don't even do a good job teaching ourselves that.
Correct.
Really. And so to expect our soldiers to do that, that's a really difficult ask. A couple things that I want to make sure we understand and almost kind of like describe to us in like the simplest terms. When you talk about vagal relaxation, What does that mean?
So the vagus is just a big nerve. It's called the traveler. It's Latin for the traveler. It travels all over the body. And a really nice attachment point for the vagus to be activated is in the gut. So it controls a lot of the rest and digest processes of the body and technically can override at any point adrenaline and fight or flight, norepinephrine in the brain, epinephrine secretion in the body. And so we want the vagus to be always as active as it can be. And simple things like deep breathing from the belly, where the diaphragm moves versus the chest, can activate the vagal response and calm the body.
And so basically what you're saying is the moment you kind of get into this fight or flight system, your vagal response doesn't ever relax for some prolonged period of time. That being said, you just have this, I would say, rush of cortisol that enters your body and stays there for 6, 7, 8, 9, 10 years.
It can. And then usually the cortisol response is dampened because the adrenals can't keep up. The cortisol curve gets flattened. And as cortisol goes, the entire stress response unfolds.
What does that mean?
And so cortisol is there to help you kind of enact what needs to happen to survive in a stressful situation. If your adrenals become burnout and you can't really make cortisol, your cortisol curve becomes flat, which means morning cortisol starts to go down. All cortisol levels throughout the whole body start to go down. And that's a known stress response. And folks with PTSD have that.
So is it that if you've been in a fight or flight position for a prolonged period of time, you can't even produce cortisol as much as you're
Which is a life-saving corticosteroid that the adrenals make in order to help you deal with stress.